Hey guys, welcome to Let's Crack NEET PG, the YouTube channel for Unacademy, our NEET PG division. My name is Chetanya Mittal. I am currently pursuing my MBBS from AIMS, New Delhi. So we are running the Cranial Nerves One Video, One Nerve series as part of our YouTube Festival 3.0. So far we have covered a lot of cranial nerves, right? And as you all know that once we are done with these cranial nerves, you will have a very good idea of the gross anatomy and the neuroanatomy part. So please do watch all these videos on these cranial nerves, and all the videos have already been uploaded. So please go ahead and download the Unacademy Learning app so you can access all the free features. For that, you will need an invite code or a referral code, and you can use the invite code or the referral code Chetanya10 for your purposes. And so you can see that we have launched a few batches. For those of you who are interested, an FMGE batch has been launched, a NEET PG batch has been launched starting from 1st February, and an INICET batch is starting from February 3rd, right? So these are the details of all the other batches also, 3 batches starting on February 6th, and then you have two batches starting on February 8th. So you can join any of these batches that you want. And then right now we also have Unacademy combats that are live. All of these, they require a referral code. You can use my invite code Chetanya10 to participate in them on an Android phone, and you can win Unacademy Plus subscriptions and Amazon vouchers, right? So you can see there are a few top educators here who are teaching on Unacademy. All of us are making free live classes for you. So there are 3 free features of Unacademy: the free live classes, the quizzes, and the combats. Besides that, there are free mock tests which you can attempt. So you can go and visit my profile. These are all the free classes that I have made. So you can see, have a look at them. And then there is a plus course that I've made on GI physiology. There are so many plus courses made by other educators. Dr. Priyashi Mukherjee, who is teaching pediatrics here, Dr. G. Rajesh, who's teaching medicine, and you will find a lot of educators for physiology as well. I teach anatomy, physiology, and biochemistry, all three. Then so I told you about the free mock test feature here, right? And then there is a comprehensive syllabus coverage. Some new courses always coming for all 19 subjects. And flexibility is the reason why Unacademy is so much preferred, because you are flexible in terms of your schedule, in terms of language, in terms of how many times you watch it. Then it's almost like a virtual classroom experience, because the chat feature is very robust, the polls are very interactive. It's almost like KBC there, and learn anytime, anywhere you want. That's the advantage. So just go ahead and install it, log in, and unlock the free plan using my plus referral code that is going to be Chetanya10, right? So please use that to your advantage. Okay. After that, get the best of Unacademy and Prep Ladder if you take the Iconic subscription. So there are 2 subscription plans for you. One is the Plus subscription plan, where you get all the benefits of Unacademy Plus, the live classes, the batch courses, live tests, and live quizzes, right? In Iconic, you not only get everything that is there in Unacademy Plus, but you also get access to the video lectures, the question bank, and the rapid revision course of Prep Ladder. So you also get the printed notes that is written here, right? So you get 19 subjects printed notes. So that is one of the benefits of Unacademy subscription. Otherwise, if you buy notes, they will obviously cost you a lot. So here they are already included in the Unacademy Iconic subscription. So you can see here with Unacademy and with Prep Ladder, with the Iconic subscription, you can crack your examination. So these are the pricing plans. For 1 year, Unacademy Plus costs 27,500, and for 2 years it is 40,000. Apply my referral code Chetanya10, and that entitles you for an additional 10% off. So right now you can see 1 year plan is at 54% off, and the 2 year plan is at 67% off. So basically, if you are using my referral code, the discount becomes 64% off and 77% off respectively for the 1 and the 2 year plan. So right now they're very well priced. Take advantage of the low prices right now, because soon the prices will increase. For Iconic, the 1 year plan is 55,000 rupees and the 2 year plan is 77,000. Again, you can use my referral code and avail an additional 10% discount here, right? So this is how you apply the referral code, and this is how you apply credits. So that is about Unacademy Plus and Unacademy Iconic. Now let's move on to a video. So now we're coming to the facial nerve. We'll start with what is almost the most important nerve for you to know, right? Although all of these are important, but in terms of the injuries and everything, facial nerve, it's a frequently asked question in your examinations, and it is the nerve which is the largest intraosseous course. You'll just see why. It also has it passes through the internal auditory meatus, and it also has its own facial canal, which is a bony canal, right? So what are the nuclei with which the facial nerve is connected, right? So we will talk about the nuclei with which the facial nerve is connected. First of all, it has its own motor nucleus, right? And here it forms the genu, right? And that is responsible for the facial colliculus on the floor of the earth ventricle, right? Then it is connected to the superior salivatory nucleus, and superior salivatory nucleus is connected here to the facial nerve, right? Besides that, the nucleus tractus solitarius, where it carries its taste fibers, that is known as the nucleus tractus solitarius, and the spinal nucleus of trigeminal, which is a sensory nucleus, is also again connected to the facial nerve. So facial nerve, it emerges from its nuclei at the lower bottom of pons with the nervus intermedius, right? So nervus intermedius carries the sensory and the parasynthetic component of the facial nerve, right? So sometimes it is known as a separate cranial nerve, that is cranial nerve number 14. But here we are including it with the facial nerve because that's what is the standard understanding, right? So it emerges at the lower border of pons. I've already told you about this. There's the pontomedullary junction where the 6th, 7th, and 8th cranial nerve are emerging. Then it passes through the internal acoustic meatus. It passes through what is known as the internal acoustic meatus along with the vestibulocochlear nerve. So after there, it goes into another bony canal known as the facial canal, right? So that is why you can see it has the longest intra-osseous course. Osseous means bony. From where it goes along the medial wall of the middle ear, right? And in the medial wall of the middle ear, there is a ganglion here that is called as the geniculate ganglion, right? So in the geniculate ganglion, the which of the fibers relay? The parasympathetic fibers, please remember, they do not relay here because the geniculate ganglion is not a parasympathetic ganglion. There are only 4 parasympathetic ganglia in your body, and this one is not one of them. From the geniculate ganglion, a parasympathetic nerve arises called as the greater petrosal nerve, and it will later merge with the deep petrosal nerve, and together they will form the nerve of the pterygoid canal. So, okay, we'll talk later a little bit in detail about this, but for now, that's what you need to know. After that, the facial nerve, it goes into the facial canal, and in the facial canal, it gives 2 branches, the chorda tympani branch. I'll just talk about what exactly are the components of the chorda tympani branch, but for now, please remember the chorda tympani branch. And it gives the nerve to stapedius, which supplies a muscle here called as the stapedius. So please remember that the facial nerve is the nerve of the second arch, So the stapedius is actually a second arch muscle, and therefore it is being supplied by the facial nerve, right? Then the facial nerve, it exits the facial canal through the stylomastoid foramen, and after it exits from here, it gives a few branches, right? It supplies the posterior belly of digastric and the stylohyoid together, right? Remember, the anterior belly of digastric and the mylohyoid, they were supplied by the mandibular division of trigeminal. Why? Because these were first arch muscles, whereas the posterior belly of digastric and the stylohyoid, they are the second arch muscles, and they will be supplied by the facial nerve here. Then it also gives a posterior auricular nerve, which is again going to supply the auricular and occipitalis muscles. After that, it enters the substance of the parotid gland, where it is dividing into 5 nerves, and that structure is called as pes anserina, right? Pes refers to foot, so it resembles the foot of a bird, right? So it is something like this. So it sort of resembles the foot of a bird, and I hope you can make out the resemblance here, right, to the foot of a bird. So it first divides into 2 branches. The 2 branches are the temporofacial and the cervicofacial. The temporofacial further gives the temporal and the zygomatic branches, and the cervicofacial gives the buccal, the marginal mandibular, and the cervical branches. So these are going to supply the muscles of your face. So they are the main supply of the muscles of facial expression, which are all going to be your second arch muscles. So sometimes the question was asked, which of the following is a second arch muscle? And one of the muscles there will be, for example, risorius, which is a muscle of the facial expression. So that is how sometimes you are asked to select an answer. So please be aware that all the muscles that are going to be supplied by the facial nerve will be muscles of the second arch, right, which includes posterior belly of digastric, stylohyoid, and muscles of facial expression, also the auricular and the occipitalis muscles. So have a look at this particular diagram. This is a very good summary of how everything works. So nervus intermedius, I told you, is carrying sensory fibers, and it is carrying parasympathetic fibers. The motor fibers are coming from the motor root of facial nerve. So the motor fibers, they are coming from here, they pass, they do not relay anywhere in the geniculate ganglion. And then this is the facial canal, right? This is the facial canal. So they will give a nerve to the stapedius. Once they have exited from the stylomastoid foramen, I already told you the main branch, it goes and it divides into the pes anserina. It divides into the pes anserina, right? Which is resembling, so which you can see here, it is all of this is happening in the substance of the parotid gland. All of this is happening inside the substance of the parotid gland, right? And inside the parotid gland here, you can see it is first dividing into the temporofacial and the cervicofacial branches. The temporofacial gives the temporal and the zygomatic branch, and the cervicofacial divides into the buccal, the marginal mandibular, and the cervical branch. The buccal branch further divides into an upper and lower buccal, and in between them, the parotid duct passes. In between them, the parotid duct passes, right? And some of the nerves fibers here from the stylomastoid foramen, they supply the posterior auricular branch, which supplies occipitalis and the auricular muscles, and it also gives the nerve to the posterior belly of digastric and stylohyoid. So that's about the motor supply. We've traced the entire motor supply, right? Next, then let's talk about these fibers here. So these fibers are parasympathetic fibers, right? They also do not relay in the geniculate ganglion, these green ones, and they will go here in the greater petrosal nerve. They will join the nerve of the pterygoid canal by merging with the deep petrosal nerve, and then they relay in the pterygopalatine ganglion. In the pterygopalatine ganglion, here they will supply the lacrimal gland, and they will supply the glands of the nasal mucosa, right? The other option for these fibers is to go down, and then they will join with the chorda tympani nerve, right? The chorda tympani nerve, it's a nerve that is going across the ear, and then it will relay in the submandibular ganglion and supply the sublingual and the submandibular glands, right? So it is the salivary supply to this. So these fibers, they are coming from the superior salivatory nucleus, and they are relaying in the submandibular ganglion. Pterygopalatine ganglion relay is for the fibers going to the lacrimal gland, and submandibular ganglion, the relay is for the fibers going to the sublingual and the submandibular glands, and these fibers are passing in the chorda tympani nerve, right? What are these fibers in blue? These are the sensory fibers. So sensory fibers will carry taste sensations mainly, right? And some of these fibers, they will go here and they will supply the soft palate. So these fibers, they are the ones, the sensory fibers are the ones relaying in the geniculate ganglion. The sensory fibers are the ones which actually relay in the geniculate ganglion. Some of them will go and they will supply the taste buds of the soft palate. Others will go to the skin of the external ear, right? And they will accompany the vagus. They will be accompanying the vagus. There are some fibers, there are very few fibers here which go to the skin of the external ear, but still it's very important to know that the facial nerve, it has a general somatic afferent component, right? And that is coming from the external ear, and there it is accompanied by the vagus, right? So basically the fibers, they will go along with the vagus. The fibers of the facial nerve, they will accompany those of the vagus, right? And then these fibers, so this was this blue line was representing the general somatic afferent fibers which were going to the external ear, and this blue line was for the taste fibers. Some of them went to the soft palate. The others here, you can see them, they are entering the chorda tympani nerve, and they will bring taste from the anterior 2/3 of the tongue, except the circumvallate papillae, So what is the conclusion? Chorda tympani nerve, it carries two kinds of fibers. What are those two kinds of fibers? First is the taste fibers from the anterior 2/3 of the tongue, except the circumvallate papillae. Second is they carry the fibers for the salivary glands. They carry the fibers for the salivary glands. With salivary glands, sublingual and submandibular. So these are parasympathetic fibers. Okay. So it has general visceral efferent fibers, and it has special visceral afferent fibers. So these are the two kinds of sensations that are carried in the chorda tympani nerve, and these are two kinds of fibers that are present in the chorda tympani nerve, and it is often asked to describe something about the chorda tympani nerve. So please remember the kinds of fibers present in the chorda tympani nerve. So this diagram is my summary diagram. It's my go-to diagram whenever I have to think about the facial nerve. Okay, so this is another similar diagram that has a representation here. You can see the motor nucleus, you can see the NTS, all the fibers here, they're connected. You can see it goes into the internal auditory meatus. There's a bend here called as the external genu. The internal genu was being formed here. It was being formed here, which is responsible for the facial colliculus, right? The internal genu is the bending of the 7th nerve around the 6th nerve, right? And that is a phenomenon known as neurobiotaxis. That occurs in a phenomenon known as neurobiotaxis. What is the basis of neurobiotaxis? See what happens. The afferents are brought by the trigeminal nerve, right? And the efferents are mostly of the facial expression. They're carried by the 7th nerve, right? So the afferents and the efferents, they want to come closer. So that's the time for mediating reflexes such as corneal reflexes. What is the corneal reflex? You put something in the eye, it is sensed by the trigeminal nerve, the ophthalmic division of trigeminal, and immediately your facial nerve tries to close the orbicularis oculi, right? And that is the corneal reflex, right? So the corneal reflex here, it is mediated by the fifth and the seventh nerve. So the idea is that a reflex should be mediated as fast as possible. So the seventh cranial nerve tries to come as close as possible to the fifth cranial nerve. So that's the basis of neurobiotaxis here. So if you talk about that, there's the external genu, here's the geniculate ganglion where I told you the sensory fibers will be relaying, right? Not the parasympathetic, not the motor, only the sensory fibers. Then the fibers going in the great petrosal nerve, they will go and they will relay in the pterygopalatine ganglion and supply the lacrimal gland, right? And there will be muscles, there will be a supply to the stapedius here, right? And some of the fibers, they will be going to the there will be taste fibers of the anterior tooth of the tongue, and there will be some fibers that will be going to the submandibular gland, and then they will be going along with the lingual nerve to supply the submandibular and the sublingual gland. Then some fibers will exit from the stylomastoid foramen. They will supply a few muscles, and then they will go into the, so the muscles here supplied are the posterior belly of digastric and the stylohyoid mainly, right? Besides that, the posterior auricular branch, which supplies the occipital and the auricular muscles. And then in the substance of the parotid gland, they will divide into the pes and serina, where one important point to remember is that the buccal branch divides into the upper and lower buccal, and in between them running is the parotid duct, right? So there is one more thing here that you can note. There is one more thing here that you can note is that what is the arrangement of structures inside the internal auditory canal, right? So a mnemonic that I use there is 7 up, coke down, right? A mnemonic there to use is 7 up and coke down. So 7 means that the facial nerve is up, and the coke, it means the cochlear is down, right? And on the sides, you have the superior vestibular nerve, and here you have the inferior vestibular nerve. So vestibular, cochlear, and facial. So that's how these structures are arranged inside. And this vertical line, this is known as the Bill's bar, right? This is known as the Bill's bar, right? So please keep that in mind. And this is a crest. This is known as the falciform crest, right? So there's a crest here, and that crest here is known as the falciform crest, right? So that is what you can keep in mind as far as the structures inside the internal auditory canal are concerned. Not very important, but sometimes they ask about the Bill's bar, right? So that's all you need to know here. And once you talk about the injuries, I'll tell you how the injuries of the facial nerve are related. So let's say there is an injury at the stylomastoid foramen, right? So what all is lost? All the muscular supply of the facial expression is lost, right? All the muscular supply of facial expression that is lost. Very simple to understand, right? Now, what if I take the lesion one level above? What if I take the lesion one level above? So what is one level above? The chorda tympani nerve that will be involved. So this is the chorda tympani nerve. So you will lose taste sensation from the anterior two-thirds of the tongue, and you will also lose salivary supply from the submandibular gland, because the salivary fibers were relaying here in the submandibular ganglion. So first level of injury is stylomastoid foramen. There what will happen? Paralysis of muscles of facial expression. Now when you injure it proximal to the chorda tympani branch, you will have to add another feature of paralysis, that is decreased salivation and loss of taste sensation. Now, what if you injure it one level higher? That is where you have the nerve to stapedius. Here you will have what is known as hyperacusis. Why? Because stapedius is involved in damping of loud sounds, and that is known as stapedial reflex, right? So now if the loud sounds, they are not damped, what will happen? You will hear some sounds as very, very high. So that is known as hyperacusis. So these two symptoms were already present, and now you will add another symptom, that is hyperacusis, if the nerve to stapedius is also lost. And if the injury is proximal to the geniculate ganglion, so you are also going to lose your lacrimation. You are also going to lose lacrimation. So there will be paralysis of muscles, decreased salivation, hyperacusis, and another feature here called as loss of lacrimation. And later that may present as crocodile tear syndrome. Now what is crocodile tear syndrome? So crocodile tear syndrome, it is related to the fact that when crocodile eats food, he also lacrimates, right? So that is due to an aberrant reinnervation here that might happen. And what will happen here is basically, if there is an injury to the geniculate ganglion and then those fibers start healing, sometimes what happens is an abnormal connection may develop here. What is that abnormal connection that is going to develop here? The great petrosal nerve which was supplying the taste buds on the soft palate, right? There was a nerve that was supplying the taste buds here. That might get connected to these fibers that are lacrimal fibers, right? There might be some fibers that get lost here. There might be some aberrant reinnervation. Aberrant means wrong, and reinnervation means after nerve injury is being repaired, right? So you might have heard of Wallerian regeneration. So something like that. So there is aberrant reinnervation, and because of that, whenever these taste buds are stimulated, the lacrimation also stimulated at the same time. So whenever patient is eating something, at the same time the patient will start tearing up, right? The patient will also have tears. So that is known as crocodile tears syndrome, right? Why? Because it is said that the crocodile, when it eats its enemy, it also cries for it, right? So that is why this is known as crocodile tear syndrome. So I hope you guys liked the video. Do hit the like button for this video. Do subscribe to our channel, Let's Crack NEET PG. Do watch the rest of the videos that are there for this particular session. I've already shown you what are the videos that are going to be there. And do drop a comment if you liked our video. Do subscribe to our Telegram channels. The link is in the description. I'll still write it here for you. t.me/Unacademy NEET PG Chetanya, right? So that's the link of my Telegram channel, and the Telegram channel of our YouTube channel is also here, t.me/Let's Crack NEET PG. Let's Crack NEET PG. So these are the referral codes. You can use these referral codes for an additional 10% off on any Unacademy subscription, and also you can use them to unlock the free features of the Unacademy app, right? So do hit the bell icon for notifications so that you get notified when your favorite educators are going live. And thank you so much for watching. So do remember to watch all the videos that are there. So this is the rapid fire cranial nerve series and one nerve, one video, right? So there are around 12 videos that I have uploaded today, exactly 12 videos that I have uploaded today. All of them are short videos. You can skip through the initial part, the first 3-4 minutes, and then you can see the videos. It will take you hardly 1.5 to 2 hours. If you watch it on 1.5x, you will even take lesser time. So do try to take as much as you can from YouTube Festival 3.0. All the best. Thank you.